Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question about upper blepharoplasty. When can an alternative to surgery, a non-surgical technique, be used? And in answering this question, we'll talk about, what are the indications for a non-surgical technique? What exactly is a non-surgical technique and what are the options available? When is a surgical technique preferred, i.e. upper blepharoplasty? And how can I ensure that I get the best surgery for me? My name is Dr. Julian De Silva and I'm a London-based facial cosmetic and plastic surgeon, and blepharoplasty is the commonest procedure that I complete for my patients on a daily basis. And so in answering this question, I'm really talking about the principles of the surgical and non-surgical techniques for upper blepharoplasty that I discuss with my patients every day. So in terms of when can non-surgical methods be used for upper eyelid surgery? Well, this is really going to be indicated where patients have relatively mild changes in their upper eyelid, and this may be relatively early changes in the skin, such as mild skin laxity. It may be an absence of fat coming forward as a bulge in the upper eyelid. It may also be the fact that there's fine lines related to movement, which may be more treated with non-surgical techniques such as Botox, and it may also depend on your ethnicity and skin type. So in terms of what are the available non-surgical techniques, well, there are a number of different techniques, and these different procedures all really favor a form of skin tightening, and skin tightening can really depend on a different type of energy, and that energy can be related to light, heat, cold, radio frequency, electrical energy. All these different devices that use different types of energy ultimately create a scar in the skin, and that scarring creates contracture and reducing the amount of skin and tightening the skin. And so although different types of techniques have been used in terms of non-surgical treatments, they all work in a similar fashion, which is tightening of the skin. One common part of the belief with non-surgical treatments is that they have no recovery. But these devices, they're really working on tightening the skin, and they do have a recovery. They are going to have some swelling, they are going to cause some redness, and that recovery time is going to vary from person to person, but it's really going to be a minimum of a week, and certainly the final result is going to be for some weeks after that. And so the term non-surgical technique in upper blepharoplasty is not a true non-surgical technique, in that there is going to be some recovery after the treatment. In addition, there are also some risks, and it's important when considering having one of these treatments that it really is suitable for you, and that may depend on the indications for the treatment, it may depend on your skin type, your ethnicity, but certainly some of these devices could actually have a negative effect on healing and scarring in certain individuals, and so it'd be important to talk that through with your doctor and your surgeon before having one of these treatments. Other alternative in early part of aging is the use of Botox, and Botox can be particularly effective for fine lines and wrinkles associated with movement, and that may be smiling, around crow's feet around the corners of the eyes, it may be frowning and a deep line between the eyebrows, and it may be lines across your forehead associated with facial movement, and Botox can be particularly effective for these changes around your eyelids and can complement upper eyelid surgery or non-surgical treatments around the eyelids. When is a surgical blepharoplasty more indicated? Well, this is going to be more when you have other changes associated with the upper eyelid, and this may be because there's more loose skin in the upper eyelid. This may be because there's a little bulge of fat and fullness that's coming forward, and all of us will have some of these changes with natural aging, but once they're present, there's no way that that fat can be reshaped and sculpted without having upper blepharoplasty. There are no non-surgical treatments that are really going to improve that. Other indications may be your skin type and your ethnicity, because there's certain ethnicities that are not going to be suitable for the skin tightening associated with the non-surgical treatments. So the other factor with non-surgical blepharoplasty is, well, generally speaking, the recovery from upper blepharoplasty is pretty fast, and certainly for my patients we use things that augment recovery, such as platelet-rich plasma, which means using your own growth factors to heal the body faster. So generally speaking, even at 1 week after upper blepharoplasty undergoing surgery, most people have a relatively favorable outcome, and although there will be some swelling and some pinkness, generally the appearance is relatively good, and with a little bit of makeup and concealer it can be difficult to tell that you've had upper blepharoplasty even at 1 week. And so really the recovery time for upper eyelid, whether it's surgical blepharoplasty or non-surgical skin tightening, well, there's not a huge difference in terms of the recovery. And it's fair to say that some people will come very quickly, some people will take a little longer, but overall the recovery with upper blepharoplasty is generally very fast when the surgery is done in a specific way and care and attention is taken to the finer detail. So the final question that we were going to talk about was, well, how can I ensure that I get the best result for me, whether that's a non-surgical blepharoplasty or a surgical blepharoplasty? Well, in terms of the best result for you, it means doing some research and ensuring that you seek a doctor and surgeon's opinion that are able to give you a balanced view and look at the changes that you specifically have in your eyelids and be able to evaluate those and give you a management plan that is specific and unique to you. And that means doing a certain amount of research about your potential doctor and surgeon. It means looking at before and after photographs and meeting with that doctor and surgeon through a consultation and talking through the potential techniques that can benefit you, the potential drawbacks, and formulating a plan based on that. So in summary, well, we've talked about non-surgical treatments that can be used for upper blepharoplasty, we've talked about the indications for them, and we've talked about the various different types. We've also talked about surgical blepharoplasty and how that can be used to particularly treat specific parts of the upper eyelid, and we've also looked at the recovery time between the two different treatments. I hope this information has been useful for you. Thank you for watching.